Hey everyone! Welcome back to our channel. If you're a tennis player or just love hitting the courts, you might have heard of a painful condition called tennis elbow. But what exactly is it? Today, we're going to dive deep into everything you need to know about tennis elbow, what it is, what causes it, how to treat it, and how to prevent it. So grab your rackets and let's get started. Tennis elbow, or lateral epicondylitis, is a painful condition that affects the outer part of your elbow. It happens when the tendons in your forearm become overloaded, often due to repetitive motion. You don't even have to play tennis to get it though. It's common among people who do repetitive activities like painting, typing, or even weightlifting. The pain usually starts as a mild ache on the outer part of the elbow, but over time it can get sharper and radiate down to the forearm or wrist. If left untreated, it can make everyday tasks like shaking hands or lifting a cup painfully difficult. So, what causes this painful condition? Well, it's mostly due to overuse of the muscles and tendons in the forearm. In tennis players, it's often caused by repetitive backhand strokes, but it can happen to anyone who repeatedly extends their wrist or grips something tightly. Over time, these repetitive motions put a strain on the tendons that attach to the bony bump on the outside of your elbow. Small tears form, and if they aren't allowed to heal properly, you can develop tennis elbow. Other factors that increase your risk include poor technique, whether you're playing tennis or doing another repetitive task, using incorrect equipment, or even not warming up properly before a workout. Now let's talk about how to treat tennis elbow. First off, if you're feeling pain, the key is to rest. Avoid activities that strain your elbow and give your tendons time to heal. Ice therapy can help reduce inflammation. Apply an ice pack for 15 to 20 minutes a few times a day, especially after activities that aggravate the pain. Physical therapy is also a great option. A therapist will guide you through exercises designed to strengthen the muscles around your elbow and improve flexibility. This can help take pressure off the tendons. An elbow brace or strap can help by reducing the strain on the affected tendon, especially when doing activities that might trigger pain. In more severe cases, where rest and physical therapy don't work, you may need more advanced treatments like corticosteroid injections or even surgery. But those are typically a last resort. Now that we know how to treat tennis elbow, let's talk about prevention. After all, prevention is always better than cure, right? First, make sure you're using the correct technique in whatever activity you're doing. For tennis, that means using the proper grip and swing technique. If you're using a tennis racket, check the grip size. A racket that's too big or too small can increase your risk of injury. Another prevention tip is to gradually increase the intensity of your workouts. If you're lifting weights or doing repetitive motions, make sure you build up your strength and endurance slowly. Strengthening the muscles in your forearms with specific exercises can help reduce strain on the tendons. Also, remember to stretch before and after your workouts to keep your muscles flexible and relaxed. If the pain in your elbow doesn't go away after a few days of rest, or if it gets worse, it's time to see a doctor. They can properly diagnose the condition and give you a treatment plan tailored to your needs. Early treatment is key to avoiding more serious issues down the road, so don't ignore the pain. Alright, that's a wrap for today's video on tennis elbow. I hope you found this information helpful. If you've ever had tennis elbow or if you're dealing with it right now, let me know in the comments how you've managed it. And, as always, don't forget to like, subscribe, and hit that notification bell so you don't miss out on any future videos. Thanks for watching, and I'll see you next time.